You are tuned into the Dr. Tina Show with Dr. Tina Moore. For more, visit drtina.com. On this episode of the Dr. Tina Show, I'm going to be talking to you about estrogen, hormone replacement therapy, and muscle. I'm going to tell you everything you need to know from the latest data that I pulled up. And the reason I'm doing this episode is because for some reason out there, there is a group of PhD scientists, some young women, some older men, who really want to claim that estrogen replacement therapy and hormone replacement therapy does not help muscle mass. And that's just plain wrong. So we're going to get into it. Okay, with all due respect, the folks I'm talking about are brilliant people, all right? They're really hung up on the data, and they're really doubling down on this concept that estrogen in particular does not help muscle mass. Why, I do not know. But because they do not have a direct causative study, they're claiming this. And that's where I think everybody's missing the mark. We don't need a direct causative study to look at physiology and backtrack and decide how this pieces together ultimately to influence positive impacts on muscle mass. Estrogen does help muscle mass, and I'm going to tell you why. So first off, this post came in, I saw it, a couple days ago, and it basically was saying that menopause hormone therapy isn't a panacea. And they listed off several symptoms that, it may help with, but it helps with symptoms and not specifically the condition itself. And again, we don't have a direct causative study showing that you give somebody estrogen and muscle mass is significantly improved. But we have plenty of studies that are very recent that I was pretty, easy. They were pretty easy to dig up that show estrogen does indeed impact muscle mass. And there's a huge crosstalk between muscle tissue and estrogen landing appropriately on muscle and what the impacts are downstream from that. So I'm going to tease this apart mechanistically. I'm not trying to get into a pissing match with anybody. These blanket claims that come in these little sound bites that you're reading on social media, I think are causing a lot of confusion. And what you're seeing is infighting. You're seeing turf wars. You're not seeing people who are necessarily having your best interest as the patient, as the middle-aged woman in mind. They claim to be protecting you. One side claims to be really, promoting women's health, and the other side is claiming to be protecting women. Let's be honest with the science is kind of their argument, right? And I get it, but in the middle is like real human beings. And I've treated thousands of them with hormone replacement therapy, and I've seen thousands of shifts happen in really amazing ways. I want to back up a minute and refer you back to a podcast episode I did a few weeks ago where I talked about my patient base in particular and how I did regenerative injection therapies for the bulk of my career. And I did a lot of hormone replacement therapy in there. And that was predominantly for those who were coming in to get their musculoskeletal complaints handled. And so I was directly seeing the impacts on the musculoskeletal system specifically. That was specifically what I was treating. I was specifically applying hormones to ameliorate different musculoskeletal conditions. And a lot of this was anecdotal that had been handed down to me by brilliant doctors over time, and it worked. And it worked almost every single time. I have never met a migraine I could not pretty much get rid of. I've never met a case of high blood pressure I couldn't ameliorate. I have never met an irretractable case of insulin resistance that I couldn't right the ship on. I've never met crazy out of control elevated lipids I couldn't impart change on significantly, all through the use of some type of hormone, whether that be adrenal or thyroid or the steroid hormones or you name it. Like, I don't understand why we're watching this pissing match going on. It's bizarre. It's really bizarre to me. And so I'm not trying to take sides here and say, everybody gets hormones. Although I do believe highly that this group over here is right and that everybody deserves access. Like, it's criminal. It's crazy. It's crazy that getting access to these hormones is so difficult for a middle-aged woman. It's mind-blowing. They'll hand them to a man who, a man goes in, I've seen this time and time again, a man goes in for testicular cancer surgery, has a testicle removed, is immediately offered testosterone. But you cut a woman's ovaries out, put them into surgical menopause, and it's like, oh no. A woman walks in, wanting, I could walk into Planned Parenthood when I was a kid and get birth control if I wanted. But you try to give a middle-aged woman hormones, and oh God, no. No, we don't do that here. So it's just bizarre. And then we've got people in the middle sort of jumping on the menopause train, trying to market off of you. And they're suddenly, they go from Fitspo influencer to menopause expert overnight, because they're trying to keep the views up on their social media, and they're trying to move with the times. That's marketing. And then you've got this group over here who are not clinicians. In fact, they have no clinical experience. They might be running studies, but they're not actually treating patients like all day, every day. And they don't have any license to give you protocols or really speak to this with authority, to be honest. They can interpret studies, and they can tell you what their studies that they're conducting are showing, which is invaluable information and wonderful, but it doesn't always translate to real human beings. I've seen lots and lots and lots of studies that I thought were amazing on paper, and then you try to apply that to an actual human being, or multiple human beings, and it doesn't translate as well. Like, we're all individual people. And while estrogen replacement therapy might really impact you in one way and impact me in an entirely different way, depending on what pathways they're going down. And I think more importantly, and the whole point of this episode is, what is the individual's overall health looking like when you apply those hormones? And how important is muscle mass to that picture? That's the bigger conversation. And I think this group is absolutely right when they tell you have to strength train. You don't need to pound protein. You don't need to, not everybody needs to have estrogen replacement therapy, but you must strength train. And I think we can all agree on that. And this group is saying the same thing, like, you must strength train. I think we can all agree on that part. And that's really what I want to double down on today. But I want to explain to you how estrogen does help with your muscle health overall. And then I'll piece it together for you. You can decide for yourself. And I'll tell you what the latest studies say. I'll even give you the studies in the show notes so you can link to them. And then from there, I'm going to explain to you why you must strength train, because muscle is a huge piece of this picture. First, I'm going to rattle off the studies for you, because I basically combined them all into one big message. And it is this. So I got a couple great studies here. I even bought some. I even purchased access to a few so that we could actually go through it together. So we've got the mechanisms of estrogen influence on skeletal muscle mass, regeneration, and mitochondrial function. This was in the Journal of Sports Medicine 2022. We've got muscle and endocrinology, from skeletal muscle hormone regulation to myokine secretion and its implications on endocrine metabolic diseases. This is the Journal of Clinical Medicine 2025. I purchased that one. You're only going to be able to find the abstract online. The next one is from Maturitas, Journal of Maturitas, The Role of Estrogen in Female Skeletal Muscle Aging, a systematic review. And then we're going to be looking at the Menopause Society, who undoubtedly is the most evidence-based organization when it comes to hormone therapy. And so what they say is very important, holds a lot of weight. And they put out a press post in September of 2024. A new meta-analysis shows that hormone therapy can significantly reduce insulin resistance. So let's just start right there. Skeletal muscle is most greatly impacted by the load you put on it, how you use it, what you do with it, number one. Number two, how you nourish it, like what you put in your mouth and what ultimately ends up turning into your muscle, right? So you have to eat it before it can build. And I think that that's a huge piece of the problem in society today, as we say, oh, people are under-exercised, and I say they're malnourished and overfed. So that's a problem. But all of that culminates into insulin resistance. And when you have insulin resistance, you have pathologic muscle, because muscle likes to turn fatty and marbled in the presence of insulin resistance. When your body is not handling your blood sugar and your blood glucose appropriately, and your skeletal muscle is not being used effectively because you're sitting on your butt all day, which is most Americans, unfortunately, then you don't end up with things shuttling the way they should, is this most simplistic way to put it, right? And the liver becomes fatty. It starts to get fatty infiltrate. The muscle becomes fatty and gets fatty infiltrate. And now we have muscle that is pathologic. Muscle's an endocrine organ in and of itself, you guys. Muscle itself is actually secreting myokines. It's an endocrine organ. I've been trying to say this for a long time, and it was not popular at first, and I don't even think it's well understood. But as an example, interleukin 6 is a cytokine that our immune system secretes. When interleukin 6 is coming from the immune system, it's pretty pro-inflammatory, and it will wreak havoc on your entire immune system. Like autoimmune disease, inflammation, at the core of a lot of problems is interleukin 6. When it's derived from muscle, from active skeletal muscle that's being used, muscle-derived interleukin 6 is a myokine, and it's anti-inflammatory. So you've got the same molecule basically, but coming out of two different systems, behaving completely differently in the body. So we have to first just understand that. Like, we need healthy skeletal muscle so that we can have healthy endocrine muscle outcomes. And insulin resistance is the first thing that will start to undermine your skeletal muscle, aside from disuse and malnourishment, which are all, again, two big players in all of this. But we have a huge problem because 93% of US adults are cardiometabolically compromised. And that was 2021 data. It was actually published in 2021 and it was 2018 data. So I firmly believe that post-COVID, especially with hopefully it's balancing out a little bit now, but that was a lot of sitting around for a lot of people, depending on where in the world you were, right? So that is probably the biggest thing I want to say here. If we can impact insulin resistance at its core, then we are by default helping muscle mass. We are by default improving your muscle. Like, period. We are making the muscle less pathologic if insulin resistance is being managed. Can we agree on that? That's really the base of my argument. And so estrogen improves insulin resistance. Estrogen, and I'm going to get into the nitty-gritty a bit more here, but estrogen does a lot of things to the muscle, specifically improving the muscle. And that 2025 study that I had to purchase actually showed a 5% improvement in muscle strength. So I don't know where this crew is getting off saying that estrogen replacement therapy doesn't help muscle. It's confusing me. And the reason I care about this is because you guys are confused and you're scared off by estrogen replacement therapy already, because for 20 years they've been telling you it's going to kill you. And then you're confused, and then you're not sure about the delivery system, and you're not sure how to find a doctor who's going to help you. And when you do find a doctor who's willing to prescribe, oftentimes they'll prescribe the oral, which a lot of us are not a fan of for various reasons, which is actually the form that some of these big issues like the blood clots are coming from. But done right, done well, estrogen replacement therapy and hormone replacement therapy in general, the correct micronized bioidentical progesterone, the transdermal estrogen, the testosterone if needed, those are game changers. And I saw it in my musculoskeletal practice. That's why I'm so passionate about this, because I literally watch this every single day. I watched people with chronic migraines get their hormones in order and all their migraines went away. I watched people with terrible frozen shoulder get their hormones in order and their shoulder pain went away and their shoulders got stronger. I watched people with Achilles issues. I shared in the last episode or a couple episodes ago, that I had bilateral Achilles rupture, and that was my first symptom of low estrogen in menopause or perimenopause. I was like, oh, hello. That was eye-opening. Time and time again, mid-thoracic spine tension, bilateral hip tendinosis at the glute med, terribly flat gluteal muscles that were flat as a pancake. The woman does nothing different. I get her hormones optimized, her glutes come back. Explain that to me. Explain to me how I saw that time and time again, and yet there's people out there saying that HRT does not improve muscle mass or muscle health. It's bizarre. It's like, but I saw this every single day for decades. How How? And again, these are brilliant people on all sides, and I respect them all immensely. I'm just confused because there seems to be this sort of war on HRT. And while I don't think their intentions on any side are malevolent, I think that it's ending you up in the middle very confused because you're not sure which way to go, and you're not sure. A lot of doctors don't have a lot of experience with HRT, and a lot of doctors don't necessarily have a lot of experience in the muscle health field, right? Like that's what these people do all day is they study muscle, and kudos to them. But I think that we're missing the boat when we're completely dismissing the patient's clinical experience and the patient's lived experience. That's part of evidence-based medicine too. The clinician's experience and the patient's lived experience and their outcomes and how they feel. That's the other two legs of evidence-based medicine beyond just the studies and the data. It's too absolute to say that hormone replacement therapy, like as a blanket statement, does not help muscle mass because of what I just said, first of all, with the insulin resistance piece. But when you look at skeletal muscle biology, estrogen deficiency worsens the quality, the quantity, the mitochondrial health, and exercise plus estrogen appears to outperform either alone. So I've mentioned before that I personally don't think hormones land or do great without muscle. And while that is also an absolute statement, and people could argue that for sure, because we don't have any data to show that causative, that you need to have good muscle mass in order for HRT to do anything. So I'm kind of making a backwards argument here. I believe that you need muscle mass in order for HRT to land appropriately and not go rogue. I think that in the body of someone who's got a lot of excess adipose and inflammation subsequent to the excess adipose, that I have seen things go very sideways. And I start to see weird symptomology. And the more insulin resistant a woman becomes because she's not training or because she never has trained, I don't see things going as cleanly. And this is coming from clinical experience from a long time of seeing this. And not just me, my mentor as well. I worked for him for 10 years before I ever got a license. So I have seen women come in, the women who came in who were really fit and healthy and lifted weights several times a week and had a pretty lean body. We could apply HRT and they would do beautifully. And the outcomes that we would have were pretty cut and dry, like pretty expected. Pretty much how we would expect things to go when we put someone on HRT. When someone came in with a lot of comorbidities, a lot of excess adiposity, and thus a lot of inflammation in their body and metabolic dysfunction subsequent to that excess adiposity. And now I know people want to argue and say, but you can be metabolically healthy and still be obese. And that is true, but I will argue and tell you from clinical experience, I will say until, because it is until their immune system decides to shift and they go down the pathway of metabolic dysfunction. It will happen. It's just a matter of when, and it's usually an age issue. But at some point, they will switch. Their whole immune phenotype will just switch, and they will become metabolically compromised, and then all hell breaks loose. So and that's usually the age cohort where we're applying HRT, right? Menopause. So we give that woman HRT, and things just don't go the way we planned as often. I start to see a lot more side effects. And I'd love to hear from those of you who've been prescribing HRT for years yourself, because it's kind of across the board. Like it just is not as smooth. And I'm not judging. I'm just saying I am a lot more careful about the body I choose to put estrogen in. And I really like to prepare that body and that patient. I got to get them on board with the insulin sensitive lifestyle. I got to get them on board with the strength training. I got to get them on board with all the things before I start throwing estrogen into it, because I don't want to create a bigger hot mess. I want to quell the mess. And yes, estrogen can be anti-inflammatory, but it can also go a little bit rogue. So anyway, all that to say, chicken or egg, what am I going to do? Well, I believe we need estrogen. And my argument from looking at all of these papers is that estrogen helps muscle quality and health overall and lands on muscle. Estrogen lands on muscle. There are estrogen alpha and estrogen beta receptors on muscle. That muscle, my argument is that muscle hears it better when it is well trained, when it is active skeletal muscle. And it's not just, muscle that's been let go. A healthy, active body will respond better in my clinical experience, to HRT, exogenous application of hormones, than if that person is sedentary, insulin resistant, and carrying around a lot of excess adiposity and thus inflammation. So that's what I've seen. And again, we don't have a ton of studies to back all of these up causatively, but we can imply based on what we know of physiology. And so to just make this blanket statement that hormone replacement therapy does not help muscle mass is kind of making a null claim. That 2023 review I shared with you in Maturitas concluded that compared to premenopausal women, postmenopausal women had reduced muscle mass and strength, and that some studies suggest a beneficial effect of estrogen therapy on muscle size and strength, even though the total evidence base is conflicting and inconclusive because of heterogeneity in dose, formulation, duration, timing, outcomes. So some of these studies are looking at oral with progestins, some of them, that we don't, it's all over the board. So it's really hard to tell, but to just straight up say, no, there's no benefit. I think that's too blanket of a statement. Estrogen is biologically active in muscle. Like I said, the 2022 Sports Medicine Review makes this very clear. Skeletal muscle contains estrogen receptors, and estrogen signaling influences skeletal muscle mass, contractility, mitochondrial function, recovery from damage, and satellite cell biology. That's really important. Your ability to build muscle really depends on the activity of your satellite cells. Estrogen deficiency is associated with impaired muscle quality and significant metabolic dysfunction. That's what that study showed. The 2025 Journal of Clinical Medicine Reviews says the same in plainer language. Estrogens play a critical role in the regulation of skeletal muscle mass, strength, and function, active through satellite cells, membrane stabilization, and mitochondrial energy metabolism. Estrogen deficiency aggravates sarcopenia. That is true. And when we see muscle just come off a woman, all of a sudden, I always think, oh no, where's her estrogen? And lo and behold, I test her hormones and her FSH is through the roof and her estrogen's in the toilet. So when I have a woman who comes in who's well-trained, like I said, that was the majority of my patient base. That's what I shared in that other podcast. When they come in and they're in great shape and all of a sudden they're like, why is my muscle all flaccid all of a sudden? Where are my quads? Where's my booty? Where are my guns? Everything's kind of soft and squishy and more flaccid, and my strength is going away. And we apply estrogen and they improve. We just need some estrogen in many cases, and the phenotype of that woman improves. So, and her tissues feel better and her pain goes down. Like, if you know anything about musculoskeletal medicine, you know that your ligaments, joints, tendons, and muscles are all BFFs. And so if your joints are on fire, the musculature and the ligaments and tendons around that joint tend to be pretty pissy. If your muscles are hurting, the ligaments and tendons around that area and potentially the joint and the bones, it's all a system. That's why we call it the musculoskeletal system, because it all goes together. When we talk about estrogen improving bone density, I often go to my musculoskeletal brain goes to, I wonder if it's because of the improvements in the muscle integrity. I wonder if the muscle tissue itself is becoming less insulin resistant and thus the bone health is improving underneath, because I believe that osteoporosis and osteoarthritis are at their core diabetes of the bone and the joints. Like, I believe at their core that those conditions start and are exacerbated by insulin resistance and by metabolic dysfunction. And so, and we have estrogen receptors in the joints and the bones, all of that. So when people say, oh, you have to get estradiol levels up to a certain point to have, bone protection, I'm like, well, what if we're doing compound things to improve that bone as well? What if we are directly impacting their insulin health and sensitivity through lifestyle changes first and foremost? Maybe we're bringing in a GLP-1. What if we're also having them strength train actively, because that's going to improve the integrity and the health of that muscle, and it will become less pathologic because it will become more insulin sensitive overall? And will that healthier, better functioning, better endocrine signaling muscle, the muscle and the bone are kissing each other, will that improve the bone health? And I say yes. I really firmly believe that. So again, we don't have these hardcore studies looking at all of these systems because so few doctors are actually treating people in a holistic manner like this. In my practice, when somebody walks in, we start day one, we have to improve your insulin sensitivity and your muscle mass. Because the other part here is we're relying in this world, all we hear about is insulin resistance. And the idea is that the only way to get blood sugar into the cell is through the insulin receptor sensitivity. But that's just one way. GLUT4 translocation up to the membrane to open and allow blood sugar in, yeah, that happens when insulin binds its receptor and the receptors are healthy and hearing that insulin. It also happens when you squeeze your muscles. When you actually physically squeeze your muscles, you get that same impact and you get those GLUT4 receptors to the membrane so that they can open and allow blood glucose into the cell so the cell can process it. And then there's the whole cellular biology piece of like, what are the cells doing once it gets in there? Are the cells stagnating because their mitochondria have gone to hell in a handbasket because they're so metabolically compromised? And we can clean all of this up first and foremost through strength training. First and foremost, but that strength training can be inhibited by a lot of reasons. We can have, in my case, I was having chronic injuries out of nowhere, chronic pain and injuries that I could not get on top of. And my coaches got so frustrated with me. They were passing me around inside of their gym because they were unsure what to do with me because I kept getting hurt. The littlest things would hurt me. It was crazy, you guys. I mean, I herniated a disc in the middle of all of that. I herniated a disc by bending over and picking up a doormat, a thin little doormat that my puppy had pooped on. And I bent down, and it's the cliche in chiropractic college. They teach you, oh, well, the patient will herniate a disc with a flexion and rotation movement. So like vacuuming or shoveling, some kind of like more intensive flexion and rotation movement. Well, I forward flexed and rotated and picked up a little thin mat that my puppy had pooped on, and boom, disc herniation. And my tissues were losing their integrity like crazy because my estrogen was so low. And I've seen this in other patients, and I talk about that on that podcast. Not like this though, never to this degree. It was crazy how often and how severe the injuries were. My poor husband, we were newlyweds. I don't know what he must have been thinking. He was like, what the heck? Who did I marry? Because he raises cattle, and he's like, when he first met me, he was like, I really like you because you're durable, which was such a big compliment to me. But it's because I was strong at the time too. I was really strong and fit. And I'm getting back to that, right? Like I'm on the path and I know what I need to do. But I'm telling you, you need the muscle mass in there to, in any way, shape, or form, remedy the insulin resistance picture because of that GLUT4 translocation when the skeletal muscle, and your skeletal muscle is your biggest sink of blood glucose. So you have no choice, in my opinion. If you want your HRT to work well, you need to have your metabolic health in order. And the only way to do that is to have your skeletal muscle in order. And so that's that big leap where we can say HRT doesn't help muscle, but it does in so many ways. And it's not always direct, is what I'm trying to get at here, is it's not always a direct route where we can say, well, this equals this. It's more of this implied biochemistry, physiology, cellular biology picture where I've just seen it countless times with patients. And that's why I'm sharing it. I mean, I'm putting myself out there because I know that folks like this like to rip apart podcasts like this and doctors like me because I don't have the right credentials. And because the ND and the DC don't add up for them. And that's fine, but I've taken care of thousands of patients and I've seen this with my own eyes and my own hands. The other thing I will add here is tissue integrity. I can feel it with my hands. As a chiropractor, I put my hands on every single patient. That doesn't mean I'm doing chiropractic adjustments on every patient by any means. It means my whole practice was musculoskeletal medicine. I was the person that people came to when they were like out of options and they were trying to avoid surgery and they were in pain or they didn't know what to do, or their naturopathic doctor or their chiropractor didn't know what to do with them, or even their MD did not know what to do with them. And so they'd send them to me and I would help piece it together for them. And if anything, I'd give them the come to Jesus talk and tell them to do exactly what they had been told to do by their other practitioner who'd referred them in, which was usually go to the gym, right? Get active. But I would put my hands on these patients and I could feel their tissue integrity change. I could feel the turgor change. I could feel the quality of the muscle and the quality of the fat and the quality of the fascia change when we applied HRT. They just felt sturdier. Everybody just got sturdier. Everybody went from squishy to sturdy. Everybody went from this sort of frail, brittle feeling to sturdy. And so when you're seeing it with labs and you've got your hands on them at the same time, that it's such a complete picture. And so everybody was getting labs ran and we were looking at at it from that side, I have the symptomology improving in front of me in real time, and I've got it charted. And I do activities of daily living on every patient. I do a McGill, which is a pain questionnaire. And I would ask them very specific questions about their story, and I would chart it. And then when they would come in and say, I don't know if that treatment worked, I don't know if I'm better. And I'm like, well, you were taking 12, ibuprofen a week, and now you're not taking any. Or you were unable to style your hair or put on your makeup because your shoulders hurt so bad, and now you can because your hair and makeup look great. Or you were unable to cuddle. I remember one guy, his biggest complaint was, he literally came to see me to treat his shoulders because he just wanted to lay on his side so he could cuddle his wife in the morning. That makes me want to cry. Like, he just wanted to cuddle his wife and spoon her. And that was her favorite thing. And he couldn't do it anymore because his shoulder hurt. So we fixed that shoulder so he could lay on his side. And I was like, okay, so we still got some popping and clicking, but can you lay on your shoulder without pain? Can you sleep on your shoulder without pain? Can you cuddle your wife without pain? And he's like, yeah, I can. Okay, great. That's a win. So that piece is important, but then putting your hands on that patient and feeling the integrity of the muscle tissue itself, I can't make that up. So, and that's not something that a researcher or a doctor who doesn't touch their patients is going to figure out. And I'm not making this up. I have no upside in this. The facts of the matter is I have been applying HRT for musculoskeletal injuries in particular, in musculoskeletal patients in particular. That was the bulk of my practice for the entirety of the time that I worked for my mentor, which was well over a decade, to the entirety of the time that I was with him for 20 some years. If you want to get nitty gritty, 10 of those years I had my own license. I saw it time and time again. You could see it with the change in how you could feel it with the change. I did regenerative injection therapy. So I was injecting these patients. The needle would traverse the tissue differently, completely differently. When you go into skin, fascia, muscle, fat, when you traverse those layers, they feel very different in somebody who has good vitality, good muscle mass, good healthy muscle, and who aren't just hanging on their ligaments and tendons for support, but they actually have the muscle mass to support it. When they're inflamed, you can feel the capsule because the capsule becomes inflamed and thickened. It's like a synovitis, and it's widespread. You can feel it in their fat. You can feel it when the needle goes through the muscle. If the muscle is pathologic, it'll grab the needle. It'll feel mushy and it'll grab the needle. And when they're active and when their muscle tissue, you could see it on ultrasound. You could see the integrity of their muscle. You could see the fatty infiltrate. This isn't made up science, And so all of these factors together, I would see all of that improved when hormone integrity was restored. The other part I want to drive home here is that 2022 Sports Medicine Review summarizes a meta-analysis of 23 studies and nearly 10,000 postmenopausal women showing that estrogen-based HRT provided small, about 5% improvements in strength, even in the absence of muscle hypertrophy. This is important. If we have improvements in strength overall, I think that's more important actually any day. And you've heard me say this on here. I want somebody to gain strength, not necessarily hypertrophy. I'm not as concerned about muscle mass. I'm not as concerned about protein intake and then muscle mass. I'm concerned about strength because it's your strength that's going to keep you from falling down and breaking a hip. It's your strength that's going to keep you from having your joint dislocate or your joint get injured under the crushing weight of, it's the little tiny old lady trying to put the suitcase up in the overhead compartment of the airplane. And I'm just like, oh no, it's not that I think it's going to come crashing down on her head. It's that I'm just watching that shoulder joint compress. There's no muscle to actually bring any integrity to that overhead position. And we're going to have a shoulder problem. We're going to have a frozen shoulder. We're going to have a problem. And then these little old ladies come in and they can't move. I will say frozen shoulder is more common in middle-aged women, but I saw one lady, she was in her 80s. She had such severe frozen shoulder that just kept worsening because she never got active. And she came in and she couldn't move her arms past, 15 degrees off her body. So we don't want to get there, ladies. We want to strength train. The hormones, I believe, land better. Like I said, again, we don't have studies to prove that, but I think they land better. And when you think about a metabolically active, healthy well signaling muscle, everything's going to land better. So we've got all the hormonal receptors there. We've got the GLUT4. We've taken up the blood sugar. We've got the healthy mitochondria. It's a whole different picture than when you look at pathologic, metabolically compromised muscle. And so that only comes through training. That's going to come through good nutrition too, but the training is the spark that makes the good nutrition go. So you can pound protein all day. And I will say that the data that these folks are pulling up and are creating, the studies, I think it's genius work. I just don't know why there's this weird, I don't know why they're so hell-bent on vilifying HRT, but they have shown, and some of the work that they're doing has shown that it's not so much the protein amount, but the actual strength training that we need to be doing. And I completely agree. Like, we need to be strength training. We got to be strength training, ladies. There's just no way around it here. If you want your HRT to go well, and then again, if we want to piece it back, if we want our HRT to go well, we need our metabolic health to be optimized. And the reason being is not even so much, okay, anecdotally, I saw patients not respond as well when they were metabolically compromised. But I also run Dutch tests and I see the pathways that these hormones go down, and it's kind of a mess. When metabolic health is not optimized, the pathways are kind of a mess. And we start going down pathways we're not necessarily wanting, like, not the good guys, not the good pathways. And that's a conversation not very many people are having. And it's like, to me, that's critical. And I'll watch that improve when they get their metabolic health optimized. And if estrogen improves insulin resistance, then you see, it makes sense. And if we have better insulin health, we have better muscle mass. And if we have better muscle mass, we have better receptivity for things to land and to function and for metabolic processes to go forward. And you know what I'm saying? I'm trying to put together a big web here. So I think that the best argument is not that it necessarily builds muscle, that HRT builds muscle. It's that it improves the muscle environment, the overall environment of the muscle, the overall health of the muscle, I believe. The signaling, because estrogen deficiency disrupts anabolic signaling. We get anabolic resistance, so then it's hard to build muscle. Mitochondrial respiration, we need that for our muscle to go. Recovery from muscle injury, myosin regulatory light chain phosphorylation, and satellite cell maintenance. That's the 2022 review in sports medicine. So that all adds up to me to HRT improving muscle health. Oh, and there's one more study I forgot to mention. Transdermal estrogen therapy improves gains in skeletal muscle mass after 12 weeks of resistance training in early postmenopausal women. This was a 2020 study, Frontiers of Physiology. The author was Dam. So the context is that women show an accelerated loss of muscle mass around menopause, which I've shared, possibly related to the decline in estrogen. Furthermore, the anabolic response to resistance exercise seems to be hampered in postmenopausal women. This was a double-blind, randomized controlled study out of Denmark, 31 healthy, untrained postmenopausal women with no more than 5 years past menopause. The primary outcome parameter was a cross-sectional area of quadriceps femoris measured by MRI, and secondary parameters were fat-free mass, muscle strength, and functional tests. The results, the increase in muscle cross-sectional area was significantly greater in the estrogen therapy group, 7.9, compared to the placebo, 3.9. Similarly, the increase in whole body fat-free mass was greater in the estrogen therapy group, 5.5%, than the placebo, 2.9%. Hand grip strength increased in the estrogen therapy group, but did not change in the placebo group. Muscle strength parameters, jumping height, and finger strength were all improved after the training period with no difference between groups. The conclusion was that the use of transdermal estrogen enhanced the increase in muscle mass in response to 12 weeks of progressive resistance training in early postmenopausal women. So they trained them and they gave them transdermal estrogen, and those were the outcomes. So the blanket statement that HRT does not help muscle mass is incorrect. And I will leave it at that. So if you enjoyed this episode, please rate, review, and subscribe on your favorite podcast player, or follow me on YouTube. I would love if you follow me there if you want to watch me yap on video, and you can leave a comment, you can subscribe, ring the bell. All of that helps. It gets the message out there further. I'm just trying to combat the nonsense online at this point because it's every day I show up and I'm like, oh, for fuck's sake. That is how I feel every time I open Instagram. So I will leave it at that. I love you guys. I hope this helps. I'm not saying everybody needs estrogen. I'm not saying everybody needs to avoid estrogen, but everybody does need to strength train. And if I can help in any way by this kind of messaging, then so be it. I do have a program. Actually, I totally forgot. I revamped my strength program. So I had a program called the Strength Corner. I completely revamped it for 2026. It's an all-new program. It's called the Strength Vault. It's awesome. It is perfect for the beginner. It is specifically geared for those of you who message me every single day and say, Dr. Tina, I want to get started strength training. I have no idea what to do. I don't know where to start. I don't want to go to the gym. I don't have the money for a trainer. I always think that the best bet, and I will say this, full disclaimer, go hire somebody if you can. If you have the means to hire somebody, you're going to get the best results and you're going to get there more safely, far more safely. This is a skill, but the program itself is very simple. It's very easy to follow. There's absolutely no reason why everybody can't access to some degree. There's videos for each exercise. I'm building it out. There's more to come. It's awesome. There's a whole module in there on the logic around strength training, why you have to do it. I go into anabolic resistance. I go into what reps and sets and all of that means so that it's very simple for you because I don't want anyone to be intimidated. You can do it from home. It's very simple. I will put the link in the show notes. It's called the Strength Vault. I hope it's helpful to you guys. Thanks for listening to the Dr. Tina Show. This is a Wellness Loud production produced by Drake Peterson. Theme song is by John the Guilt. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtina.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtina.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.